everyone, welcome back to part 2 of Trigger Finger. Today we'll be talking about trigger finger treatments in detail. The treatment for trigger fingers including non-surgical and surgical treatments. For non-surgical treatment, usually it's a cortisone injection. And if the cortisone injection didn't work, then we move to the surgical treatment, which involves a minor surgical procedure. So initially, if your trigger finger is not very severe, we'll offer cortisone injections. You can look at it as a small, it's almost like a flu shot. It's a small amount of cortisone injected into the area where the inflammation is, usually either in this area for fingers or at the base of the thumb for a trigger thumb. The cortisone injection is usually not that painful. And after the injection, there's really no downtime, so we can use it right away. However, we don't recommend multiple injections for cortisone. The reason being that the cortisone injection is not completely benign. It does have side effects, and it does carry a small risk of tendon rupture if it's injected multiple times in the same area. Therefore, most hand surgeons will probably recommend at the most 2 cortisone injections. As I mentioned before, there are some side effects even with most benign cortisone injections. Most common side effect is just temporary pain and swelling at the injection site, just like when you had a flu shot. Usually we recommend after the injection, you ice the area on the day and then resume regular activities. There are other side effects also related to patients' own medical history. For example, if you are diabetic, the cortisone injection does affect your blood sugar. It will increase your blood sugar reading for the next 24 to 48 hours. So for patients who has diabetes, after a cortisone injection, you really want to check your blood sugar and make sure to keep them in a good range. Lastly, as I also mentioned before, too much cortisone is kind of like too much of a good thing. It's not beneficial if it's used repeatedly in the same area. Specifically, the cortisone is toxic to tendons. Therefore, at the worst case scenario, rarely it can cause tendon rupture. So sometimes the injection feels like a little sting, a bee sting, but it's very minor discomfort. Once the injection is in, actually people feel better pretty soon. For example, once you have the injection in, you may have a little bit of pain and some numbness because we mix the numbing medication with the medication so that you don't have much pain after the injection. Usually, patients start feeling better within the same week. And by 3 weeks, majority of the patients should be symptom-free. So sometimes, if the cortisone shot doesn't work, say you had 2 injections already and still experiencing the same symptoms, or the symptom went away for a while and then now came back. The next step is the surgical treatment. So what is trigger finger surgery? Basically, what we do is we make a small incision in where the problem is. Again, in the fingers, in these areas, in the thumb, in this area. Through that incision, we go in and open up the tunnel that is keeping the tendon from gliding normally. Once the tunnel is opened, there's no scar tissue that's holding down the tendon. Then the tendon can glide normally and that problem goes away. Usually the surgery is very successful and it's a very minor procedure. The trigger finger surgery is actually quite short. For example, it takes about 15-20 minutes for trigger finger surgery. We call it a minor procedure in a sense that majority of the patient can do the surgery with just local anesthesia, which means we'll just numb up the area where the incision is going to be and no extra anesthesia needed. After the surgery, we'll put you in a small dressing and we'll encourage you to move your finger right away so you can have the tendon start gliding normal again. The only restriction after surgery is to keep everything, the incision clean, keep it dry, and elevate when you can. In about 2 weeks, we'll take the stitches out, then you can pretty much go back to normal activities. So recuperation from trigger finger surgery is quite short. You can start doing normal stuff right away and just have to keep the incision clean and dry for 2 weeks. If the trigger finger is ignored and not treated, it can continue to get worse and patient can develop what's called locked trigger finger. Locked trigger finger means that you are not going to have any movement. Again, for regular trigger finger, you can still move it, but it'll be catchy, it'll be locking and clicking. Locked trigger finger means there's so much scar tissue, people cannot even bend or straighten their finger. It can get locked in either extension, which means you cannot bend your finger at all, or it can get locked in flexion. For example, the thumb, you cannot straighten the thumb at all. When that happens, it's a little more difficult for a patient to recuperate, and the surgery may take longer and more extensive. Therefore, we recommend when you have trigger finger, let's take care of it sooner than later to avoid all these complications. Thanks for watching our 2-part series on trigger finger. You can subscribe to our YouTube channel, follow us on social media, and you can always find us at ochandsurgery.com. See you next time!